Welcome to your online lecture for Chapter 16 entitled Environmental Emergencies. When we think about environmental emergencies, we can say that they can occur in any setting, whether that be the wilderness, if you're outdoors and you're camping, rural areas, suburban areas, and also urban areas. They include exposure to heat and cold most commonly, but they are also not limited to bites and stings from insects, spiders, snakes, and also marine life, which we probably would encounter most often in sunny San Diego. But just as important as the first responder care is in these emergencies, it's also important that you as a first responder be aware and recognize that the cause of the emergency may put you at risk. And so it's always important for you to ensure your own safety and the safety of your crew or the other first responders around you. And so when we think about environmental emergencies, the two major environmental emergencies that we're going to talk about in this online lecture are going to be heat pathologies and cold pathologies. So we think about heat and environmental pathologies that are caused by increased heat. We have to learn, first of all, that heat can be transferred and or lost in 4 different ways. And so the first way that heat can be lost is through the process of convection. And when we think about convection, what we would say is that body heat is going to be lost to surrounding air. And so we can say that this occurs when moving air in the environment passes over the body and carries heat away. And one example of convection is like when we're running outside and we start to sweat, and if it's windy, what do you notice? That when the wind hits your skin, that sweat starts to cool. And so that's one way to kind of remove heat from the body if you're starting to get overheated, is through the process of convection. Again, that's when heat is lost to surrounding air. And so we could say like a wind chill. If we have wind and the wind blows across someone who's hot, that in essence causes the patient to lose heat, and this is a good thing. The other way of losing heat on the list is through the process of conduction. And so when we think about conduction, what we're basically saying is that body heat is lost to nearby objects through direct physical touch. And so one example of this would be a swimmer who is warm, jumps into the water, and then they lose heat to the water through direct contact with the water. And more clinically speaking, if we're in the athletic training major, we would say that a patient who gets into a cold whirlpool would also lose heat to the cold water once they hop into the cold whirlpool. We can also lose heat and or transfer heat through the process of radiation. And so when we think about radiation, we're saying body heat that is lost to a nearby objects without physically touching them. And so this method's going to involve the transfer of heat to the object. And so most heat loss is from the head and the neck and areas rich in blood and blood vessels. And so in sunny San Diego, we think of radiation, really what we think about is like sunbathing, laying out in the sun, where the sun kind of starts to absorb some of the heat that's coming off of your skin. And then last but not least, we can also lose heat through the process of evaporation. And so what is evaporation? This is the process where sweat changes to vapor. And when it changes to vapor, or when it has that drying effect in essence causes a cooling effect. And so it's kind of interesting to note that even though we do have the ability to evaporate our sweat, that the ability to do so stops when the relative humidity of the air reaches about 75%. And so in your states on the East Coast where humidity tends to be really, really high, this poses a big problem, because if we can't release sweat to the epidermal layer and that sweat doesn't dry or evaporate, then that patient continues to keep heat in and they eventually suffer from heat illness and or a medical emergency, which we call heat stroke. And so the 4 major ways, again, that we could lose heat is through convection, which is when we lose heat through the surrounding air; conduction, which is when we lose heat through some direct touch with an object; through radiation; and then last but not least, through evaporation. These 4 ways become crucially important when we're thinking about a patient who is suffering from some type of heat illness, and we'll talk about why when we get into the specific pathologies. I'm not sure if your text talks about the hypothalamus, but I think it's very important to talk about this anatomical structure, because the hypothalamus really is the thermostat, the human thermostat in the body. And so why do I say that? Because it's really responsible for regulating internal temperature. And so we could say that the hypothalamus has our body set at a set point, and the normative temperature within the human body is about 98.6. And so we would say that is a normative temperature. So we're taking an adult temperature temperature with a thermometer, the average adult temperature would be about 98.6. Anything that is above or below that number then causes the body to either dissipate heat if it's above to reduce the temperature within the body, or to, if it's below that 98.6, to produce heat so that the body might start to warm up. If it is the case that we encounter a patient in heat stroke where the body temperature has elevated above 106 degrees, then the biggest concern is that the hypothalamus, which is the major regulator for internal temperature, does not work. It completely shuts down, and the only way to cool the body is through external means. And so we could kind of say, putting someone in a cold whirlpool or packing them with ice bags would be an external means to reducing temperature or core temperature within our patient population. So again, if we're keeping things in our car, maybe some breakable ice bags would be a good thing to have for our first aid kit that we're building for this particular class. So now we're going to talk about the category of heat illnesses or heat emergencies. And so basically what we need to know is that when a person cannot lose excessive heat, he or she develops what we would call hyperthermia, right? Which is an increase in core temperature because our vessels at the epidermal layer are not vasodilating, allowing our body to remove heat. And so if left untreated, hypothermia can lead to organ damage and death in some patients. And so it's important for us as a first responder to be able to recognize the major illnesses within the heat category. And they could be entitled heat cramps or heat illness, heat exhaustion. And last but not least, but definitely a medical emergency, would be heat stroke. And so heat stroke is the most serious and most life-threatening of all of the heat illnesses that we're going to talk about today. So what are some of the common signs and symptoms of hyperthermia and heat exhaustion before it progresses to heat stroke? And so some of the common things that are signs and symptoms that our athletes or patients will report with will be cramping, specifically cramping in the gastrocnemiae, or as you guys might know it as the calf. So you get cramping in the gastrocs. So your patients will report with cool and clammy skin. And so when you touch the skin, even if it's 100 degrees outside, your patient's skin feels really, really cool. And then you get what we call skin tinting. And so when you pinch the skin, what it does is it tints together or blotches together, and it takes a long time to return to its normal color or its normal state. And then during the rested state, so once we've calmed our patient down, we've elevated their feet, their pulse, specifically their radial pulse, is probably going to be a little bit weak. And so in some cases, if you're covering an athletic event, you might encounter the patient who presents with full body cramps. And so that's the person whose calves are cramping, quads, hamstrings, everything, their stomach, their chest, everything, every muscle in their body starts to cramp. In this case, we need to get them an IV ASAP. The IV will help restore and replenish any fluids that have been lost. So how do we care for someone who we suspect has heat illness in an emergency situation? I really do think that this figure tells you exactly what you need to do. Really, the first thing, most important thing, is to remove the patient from the activity. If the activity is outdoors, then you want to remove the patient from that environment and put them into a cooler environment. And then what we want to do after that is really do things that would reduce the patient's core temperature. One thing that is recommended is that we do not immerse in cold water unless a physician instructs us to do this. And the big reason for this is because when we take a person who has an increase in their core temperature and drop them into extreme cold situation, you really do run the risk of exposing your patient to cardiac arrhythmia, which means they could eventually go into cardiac arrest. And so the best way to reduce the core temperature without dropping them into a cold bath of water is really to just give them to put ice towels on their forehead, groin, and armpits. And so why these areas? These are the areas that tend to hold in the most heat. And so if we can cool these areas down, then we would see a significant drop in the core temperature of our patient. Other areas that you can put ice packs that are really good are at the head and the feet. So if we really want to reduce core temperature, if our patient is wearing any type of hat, we would remove the hat. And then if they're wearing shoes and or socks, we would also remove their shoes and socks so that the feet and the head can release heat as well. If the signs and symptoms fail to improve with all of this treatment, then we may need to call 911 or refer the athlete to the hospital to get an IV to restore and replenish any fluids that have been lost. So we kind of just talked about heat illness and heat cramps, right? And we said, okay, these patients, they are conscious, they have sweat on their skin may be cool. Once you reduce the heat, they return to within normal limits. The big deal with heat cramps and heat illness really is the patient is dehydrated, needs to be removed from the environment, and then on top of that, we have to reduce their cramping, and we can kind of do that with the restoration and replenishment of fluids into the body. On the opposite end of the spectrum, and probably the most life-threatening pathology that a patient could have in a heat environment or a heat emergency is heat stroke. And so we kind of have to talk about heat stroke so that we know how to recognize the signs and symptoms. One of the number one signs and symptoms of a patient who is going into heat stroke or who has heat stroke is that in a completely warm environment, after completing their task or their skill or their sport, the patient will have dry skin. And so you might say, well, how will I know this is not normal, right? Well, the big deal is if it's 90 degrees outside or 104 degrees outside, the patient should have some type of sweat or perspiration on their skin. And if they don't, and they are complaining of fatigue, if they are complaining of cramping or stomach cramps, then we could kind of say that this patient is probably going to be in heat stroke. Now, there are other signs and symptoms that are associated with heat stroke that are not associated with the other heat illnesses, and some of those have to do with their levels of responsiveness. So mental confusion, they might be delirious. They might even go into a loss of consciousness. They could potentially go into a coma if the brain's being starved and they're unconscious. So these two kind of are really linked together. And then last but not least, when you check their core temperature, the core temperature will be at least 105 degrees, if not higher. Now, remember I said that at 106 degrees, the hypothalamus begins to shut down. Well, if the hypothalamus shuts down, then we have to figure out a way to reduce their core temperature from an external standpoint. So if you recognize at least one, if not two of these signs and symptoms, this is a medical emergency and we should be calling 911 right away because our patient can die. Why? Because eventually they will go into an unconscious state. And when they go into an unconscious state, remember there's decreased oxygen to the brain and the heart, and eventually our patient goes into cardiac arrest. And so this is a 911 medical emergency. There are several risk factors or contributing factors that really do contribute to the patient's ability to develop either heat illness and or heat stroke. And some of those contributing factors include high air temperature, which can reduce the body's ability to lose heat. High humidity could be another one. Exercise and strenuous activity during the hottest part of the day. And then there are other risk factors such as age, certain medical conditions. But one of the number one risk factors for developing a heat illness is really lack of fluid intake and or what we would call dehydration, which occurs really due to fluid loss. And so we're going to kind of spend a little bit of time here talking about how important it is for us as clinicians to make sure that our patients are maintaining good fluid balance. And so during exercise, I think it's important that we reiterate to our athletes that they still need to take in fluid, that even though they're practicing or competing, that when they take a break or when they stop or when there's a timeout, that we're constantly giving them water to keep them hydrated to reduce their risk of heat illness. One other thing that keeping them hydrated does is it reduces their chance of cardiovascular stress because the heart has to work less hard to pump blood out to the rest of the body in a hydrated person when compared to a dehydrated person. And one thing that we can also do to reduce body temperature is to give our patients cold fluids. When we give our patients cold fluids, that actually reduces their body's temperature. It enhances body cooling, and the other thing is that it can be excreted from the body a little quicker. And so when we think about fluid balance and why that's important, it's really important because one of the number one risk factors for developing heat illness is dehydration. So if we as clinicians are always making sure or educating our athletes on being hydrated, then they have less of a chance of developing heat illness. That being said, we do know that there are other contributing factors that we can't control, and age or medical conditions could be one of those. So what are some things that we could do to educate our patient on hydration? One of the things that we do here at Point Loma Nazarene University is we put these urine charts in every stall of the bathroom. And so it allows our patients to look into the toilet after they've urinated to see whether or not their urine is a specific color. And really what you want to know is does the patient's urine look like this, or does it look like this? If it's more yellow or goldish in nature, then we would say, okay, this is a dehydrated patient. They need to drink more water. And then in the opposite end of the spectrum, a urine specimen that looks more clear, we would say that that patient is hydrated. In a typical human being, adult human being that is, urination should occur about every 2 to 3 hours when you are properly hydrated. And so you will know if a patient is hydrated whether or not they are frequently urinating. If they don't frequently urinate, maybe say they're urinating once or twice a day, then we need to educate them on potentially increasing their fluid intake. One rule of thumb is to always drink water before you're thirsty. If you wait until you're thirsty to drink water, then you're already dehydrated. And then what I always tell our athletes is drink water all day long. You should be living, eating, and sleeping with a water bottle in your backpack underneath your pillow. I just think it's important that we're refilling this water bottle, that we're drinking water as much as possible to, again, reduce the risk of heat illness in our athletes or the athletic population, or even in environmental situation where it's extremely hot and humid. So moving on to the opposite end of the spectrum, cold injuries. Exposure to cold can cause two generalized types of emergencies. One is a generalized cold emergency, which is called hypothermia, and it's just going to involve an overall reduction in the body temperature, which can be deadly. And then the other kind of emergency is called a local cold injury. It's when you actually have damage to body tissues in a specific local body part, and we're going to talk about those two different types of cold emergencies and how to care for those as first responders. So you might ask, well, we've talked about how the body releases heat, and so now we kind of have to talk about how the body conserves heat. And so how does it conserve heat is a really good question. In the cold, what we could say is that the body holds on to heat by constricting the blood vessels, specifically causing vasoconstriction of the blood vessels near its surface, and that's typically in the epidermal layer. And this vasoconstriction really traps the heat. It does not allow heat to be released from the body. And in addition to that, we also have the hair, so our hair that is on our skin stands erect, and what that does is it kind of thickens the layer of warm air trapped near the skin or next to the skin. The body can produce more heat if needed, and it kind of does that by shivering and producing certain hormones such as epinephrine. Now, here's the deal when we think about the body conserving heat. One thing that we think about is that there's really little or no perspiration / sweat that's released to the skin surface. And this is a good thing, because if we already have a case where there's a cold emergency, you don't want perspiration sitting on the skin, because if there's a wind chill, the wind will come by and cool the skin even further. And so little or no perspiration is released, and the reason it's not released is because we get superficial vasoconstriction, we get the hairs of our body standing erect, we get the shivering, and we're really creating an environment that is created to conserve heat or to trap heat so that our patient's body temperature does not decrease. So with hypothermia, what we have is a situation where the body loses more heat than it can produce. So in other ways said, it's losing so much heat that our core temperature begins to drop. And so again, when we think about the hypothalamus, we said, okay, the hypothalamus shuts down at about 106 degrees in a heat illness situation. And then in a hypothermic situation, the hypothalamus tends to lose control, or it tends to not function as well as it has when we have a core temperature that drops below 95 degrees. And I think some other things to keep into consideration, especially if you're moving to a cold state such as Minnesota or Canada, where it snows a whole bunch, is that if the core temperature drops to 79 degrees, then more than likely your patient's going to be in a comatose state, and we'll have to care for them accordingly. So if we have the case where we encounter a hypothermic patient who is in water, I think there are some other things that we also have to keep in the back of our mind. And one of those is that heat loss, body heat loss, is 2 to 4 times. Heat loss occurs more quickly in cold water than it does in air. So let's take the person who is stuck in, like, let's say, an ice glacier in the water. They'll lose body heat 2 to 4 times quicker than a person who's stuck in a snowstorm and is standing erect. And so skin heat loss via conductance, remember we said direct contact with an object can be 70 times greater than that of air at the same temp. And so what we really want to think about is the patient who's submerged in cold water. They're going to lose heat a lot faster than a patient who is just standing in a snowstorm. And so we have to care for them more quickly and more rapidly. This kind of goes back to the triaging effect than the person who is just standing and being exposed to the cold air. So what are some signs and symptoms of hypothermia? You kind of see them here on the patient's face. You get these dark blotches of skin in your dark patient population, so that ashen color. Your patient will have slow breathing, slow pulse. In some cases, if the core temperature drops below 79 degrees and you get the patient who's in a comatose state and is unresponsive, they might have fixed and dilated pupils, definitely rigid, right, extremities, and then they may not shiver, right? The body's protective mechanism to keep in heat is to shiver. But when you get to the extreme cases of hypothermia, the patient loses their ability to shiver, which means they're losing their ability to keep their heat in. So there are 5 stages of hypothermia, and the first stage is the shivering, kind of what you see to the right, the person chattering and shivering to maintain heat. And then after the shivering, what we get is apathy and decreased muscle function. So the patient really loses their motor ability, their ability to move their arms or their limbs because their muscles are just so tight and rigid. You get decreased responsiveness. And at this point, we could say, okay, core temperature must have reached at least 79 degrees for this to be the case. When stage 4, we have decrease in vital signs. So you get your decrease in your pulse, decrease in your blood pressure, decrease in your heart rate. And then last but not least, if we do not remove the patient, or if we do not begin to heat our patient back up and to restore core temperature, our patient typically dies in the field. So ideally, the goal as a first responder is to get your patients in these 2 steps so that you can start the rewarming process. You can increase core temperature. The hypothalamus can start to kick in again, and it can start to increase core temperature. So how are we as first responders going to manage someone who has hypothermia? With hypothermia, what we want to do is remove the patient from the environment, and with the goal of hopefully putting them in what we would consider to be at least a room temperature, if not a warmer environment. We want to give them warm fluids, so your hot chocolates, your warm teas, you could warm up just a cup of water. You want to layer them with blankets, again, with the goal being to try to trap in heat. We want to remove wet clothing from our patients. Now here's the deal. If you have a patient who's the same sex, you can go ahead and remove their clothes as long as they're comfortable. However, if you encounter a patient who is of the opposite sex and they are uncomfortable removing their clothes, then that's okay. Just go ahead and continue to layer them with blankets. The big deal is do not attempt to rewarm them, meaning do not attempt to put them in a warm, hot bath. The reason being is because of the nervous system. Typically in patients with frostbite, the nerves aren't firing and sending signals to the brain, and so you might actually increase the patient's chances of being burned because they cannot feel how warm the water is. If your patient is unconscious, or if they are having changes in their levels of responsiveness, then we want to deliver oxygen or administer oxygen ASAP. Want to be very gentle with the patient, again, because they really may not have sensation. They might actually be numb. And so one thing to keep in mind, if you encounter an unconscious patient who you've taken out of, let's say, a cold body of water and is unconscious and does not have a pulse, one of the rules is your patient isn't dead until they're warm and they're dead. And so take the patient out of the lake or out of the ice, lay them down, do your CPR. Once the body starts to get warm, if they don't have a pulse and they're not breathing after they're warm, then we could officially say that they are dead. When in doubt, always give your patient treatment. Let the advanced medical care determine whether or not the patient is deceased. Your major role as the first responder is just to provide the care that you can for that patient in that specific emergency. So we've talked about cold injuries that are more local in nature that actually affect a specific body part. So most commonly the local cold injuries or the frostbite is going to occur. Two things that are most commonly exposed. So your face would be one area, your nose, your ears, hands, fingers, feet, toes. And we would all say that those are like distal extremities, really. And so this type of emergency is called what we'd say is a local cold injury and or frostbite, depends on who you ask. So what is frostbite? Basically, it's when the body part is exposed to intense cold. So again, the ears, nose, any of the distal extremities, they become exposed to intense cold. Blood flow to that part is limited because of the vasoconstriction of the blood vessels to kind of keep in heat. And so when this happens, you don't get blood flow, tissue temperatures drop, the tissue starts to freeze, the local tissue starts to freeze. And one of the most painful things is that ice crystals begin to form within the actual skin itself, and that becomes a very painful process. And so when they form, and in most cases, most severe cases, gangrene can set in and ultimately lead to the loss of a body part. And so it's important to catch the patient who is in hypothermia so that it doesn't lead to frostbite a little bit later. So we can kind of see that as we were talking about the frostbite, that some of these figures are kind of gruesome in nature, but I really need you guys to appreciate what a patient would look like if they had frostbite. And so we can see that frostbite really does affect the distal extremities. And in some of these cases, these patients probably have gangrene and they would probably lose their limbs. In other cases, they're not as extreme, but this ear right here would be a case of a frostbite where the crystals underneath the ear have begun to form, and you get a little bit of swelling, and then you can also see the burns here from frostbite, and then the patient's nose being heavily affected. And so this is what frostbite would look like if you encountered it in an emergency situation. So how do we grade frostbite? Just like we would grade an ankle sprain or an ACL sprain or any other type of sprain, we kind of have to grade our frostbite. And so type 1 frostbite, just the skin is affected, or we would say the epidermal layer would be affected. And this patient's skin would look blanched and white. They would be numb, but the tissues would still be very soft. And so we would say epidermis is affected. And then you get your second degree or your second type of frostbite, which is when your epidermis and your dermis layer, or the skin and the layer just beneath it, so epidermis and the dermis are affected, and your patient will present with, again, blanched white skin. The skin is actually going to be firm this time and waxy. You get blisters that are filled with cold fluid. Your type 3 type of frostbite, the skin, and so we say skin, we'll say epidermis, the dermis, and then we would also say the nerves would also be affected at this level. And then again, we could see here what the patient's skin and presentation would look like. And last but not least would be the worst form of frostbite, and it's the 4th type. It's all of the layers in addition to the muscle and also down to the bone become infected. And so this patient's going to present with waxy white to deep purple skin, swelling, blisters, and numbness. Again, the biggest differential would be that waxy deep purple appearance in our patients with a type 4 type of frostbite. And why do I give you this chart? I think it's important because it helps us determine how far along our patient is in the frostbite process, how much tissue has been affected by their exposure to the cold. So when rewarming a patient or a patient in an emergency situation with either hypothermia or frostbite, we want to use water that's about 100 to 105 degrees, no higher than that, because we could burn our patient without them knowing it. We want to rewarm the entire area that's been exposed. Never allow the body part to touch the side of the container. Again, this has to do with the fact that they probably don't have good nerve activity, and so again, we want to reduce their chances of being burned. Big deal is to never rewarm deep frostbite, and one of the rules of thumb is that if it's truly type 4 frostbite, we don't want to rewarm it because it could actually cause the crystals to burst, and that actually kills off more skin cells than we need. Never rewarm if there's a chance to refreeze. So if you're rewarming the patient and they're getting ready to go back into the same cold weather, you're going to refreeze your patient. We never want to rewarm. And if you have some Tylenol, you can go ahead and give your patient some Tylenol to reduce the amount of pain that they might be in, and then cover the area, because even to look at it might actually make your patient go into shock. So we want to cover the area to just protect our patient and make our patient comfortable if we can. This is the end of your online lecture for Chapter 16. The only portion of Chapter 16 that I did not go over is bites and stings. You will be responsible for this on your quiz, so please make sure to look at Chapter 16, the end portion of Chapter 16, to understand and to determine how you as a first responder will care for a patient who has either been bitten or stung by some type of insect and or animal. Have a wonderful day. Hopefully I'll see you tomorrow.